10 medications that destroy your liver, and what are the symptoms that your liver is getting sick. Welcome to Liver Disease Code channel. Did you know that all the medications and supplements you take have to pass through your liver? The liver acts as an unsung hero, working hard to filter and process all of these substances, store the nutrients, and get rid of the waste. But some medications can directly damage this vital organ. This is also the most common cause of acute liver failure in the United States. In today's video, we'll discuss the 10 most popular medications that can harm your liver, what symptoms to look out for, and what you can do to prevent and safeguard your liver against these potential harms. Let's go. Elevate your well-being with just one click. Don't forget, like, subscribe, and hit the notification bell to receive the latest and greatest health tips from Liver Disease Code channel. Before we dive in, I've got a fun little brain teaser for you all about the liver. Here's the question. How big do you think the liver is? A. Soccer ball. B. Golf ball. C. Ice hockey ball. Take 10 seconds to reflect and post your answer in the comments. Don't forget to watch until the end of the video to discover the correct answer. Now let's start with the first medicine, pain relievers. A viewer named Henry shared, "My mom lost her battle to liver cancer just a week before her 70th birthday. She only survived 2 weeks after being diagnosed. Her diet was terrible. Lots of junk food, plus 5 spoons of sugar in her coffee every day. And she smoked red cigarettes for years. In hindsight, she was always complaining about pain on the right side of her abdomen near the ribs, and she had to rely on Tylenol several times a day for relief. I can't help but think Tylenol played a role in her cancer." In fact, Tylenol, acetaminophen, is a common over-the-counter, OTC, pain reliever and fever reducer. It's not toxic to the liver when it's taken occasionally and within recommended dosages. However, large doses and/or chronic use can cause liver failure, which has a high mortality rate and often requires a liver transplant if the organ cannot regenerate itself. This concern is more relevant among people who have a serious illness, alcohol use disorder, or pre-existing liver issues. You should call poison control or go to the nearest emergency room if you suspect you have taken too much Tylenol. You also can lower the risk of liver problems related to Tylenol in the following ways. Don't take more than the maximum recommended amount, 4,000 ml per day. Avoid drinking alcohol while taking Tylenol. Check to see if any of your OTC or prescription pain medications contain acetaminophen, so you can avoid accidentally taking it from multiple sources. Keep in mind that Tylenol is also found in many OTC cold and flu products. 2. Anti-inflammatory medications. Diclofenac is an anti-inflammatory medication frequently used to alleviate pain from various injuries and conditions, including arthritis. The concern primarily relates to oral ingestion rather than topical application. The topical applications, such as gels, creams, and patches, carry a lower risk of liver injury since the body absorbs significantly less of the drug compared to oral forms. Diclofenac stands out among non-steroidal anti-inflammatory drugs for its potential to cause liver injuries. Regular, long-term use, especially in people prone to liver problems, can increase but serious liver reactions such as liver failure, fulminant hepatitis, liver necrosis. Although serious liver damage from diclofenac is uncommon, but the risk is higher for women and with larger doses and/or long-term use, more than 4 weeks. 3. Amoxicillin Clavulanate antibiotic. This right here is a go-to antibiotic, super effective for knocking out all sorts of infections, including sinusitis, tonsillitis, pneumonia, and even urinary tract infections. If you've taken this medication before, please let us know in the comments by simply typing the number 1. Now, even though this medication gets the job done, there's a big issue to be aware of. It's one of those antibiotics that can really mess with your liver. Liver trouble from amoxicillin clavulanate often shows up as jaundice, which can be severe and long-lasting, jaundice lasting 4 to 24 weeks. So, when it comes to prescribing or taking amoxicillin clavulanate, it's crucial to keep this risk in mind. Patients need to know to reach out to their doctor right away if they notice any signs like jaundice, yellowing of the eyes, dark urine, extreme tiredness, nausea, vomiting, or belly pain. These could all be signs of liver issues, and it's important to address them promptly. 4. Amiodarone. Amiodarone is commonly used by cardiologists to effectively treat cardiac arrhythmias, making it one of the top choices for this conditions. However, it is important to be aware that amiodarone is one of the medications with the highest index of side effects. It can affect the thyroid, lungs, skin, and the liver. Because of this wide range of side effects, its use has been more restricted currently compared to the past, being applied in specific cases where the benefits outweigh the risks. Additionally, if you're over 65, you might experience more side effects from the drug compared to younger individuals. Generally, amiodarone does not cause acute liver injury. It takes a few weeks to months for the harmful effects on the liver to manifest. So, it's important to have a good grasp of amiodarone to monitor and use it correctly, and to catch any potential complications early on. 5. Allopurinol. For individuals with elevated uric acid levels or suffering from gout, diet modification alone is not always sufficient to control the condition. Therefore, allopurinol is frequently prescribed to provide more comprehensive management of the condition. However, it is important to be aware that allopurinol can have adverse effects on the liver. Liver injuries associated with the use of allopurinol can occur quickly, sometimes within days or weeks after starting treatment. For this reason, patients who start treatment with allopurinol should be carefully monitored for any signs of liver damage. 6. Anti-seizure medications, like phenytoin. Anti-seizure medications top many lists as potential causes of liver injury. Phenytoin dilantin is one of the most common causes of drug-induced liver injury and liver failure. Liver injury typically occurs 2 to 8 weeks after starting treatment with phenytoin. Almost all phenytoin hepatotoxicity cases happen as part of broader medication reactions that affect the whole body, such as anticonvulsant hypersensitivity syndrome. However, most cases of this type of liver injury resolve within 1 to 2 months of stopping treatment with phenytoin. 7. Isoniazid. Isoniazid is an antibiotic that's effective at preventing and treating tuberculosis, but it's one of the top 10 most likely medications to cause drug-induced liver injury in multiple countries. Increased liver function tests can affect up to 20% of people taking Isoniazid. Most cases of Isoniazid-related liver problems are mild and/or resolve within 1 week of stopping treatment with the medication. But Isoniazid also has a boxed warning regarding the risk of severe liver inflammation. The risk of liver failure related to Isoniazid is higher for women, Black people, and people with existing liver problems. It's also higher for older adults and people who drink alcohol daily. 8. Antifungals. Antifungals, particularly fluconazole and itraconazole, are highly effective in treating candidiasis and nail molds. But here's the thing. They have a bit of a dark side, especially for some sensitive individuals. These antifungal medications can cause hepatotoxicity. So if you're using these medications to tackle mold issues, it's crucial to know the signs of hepatic toxicity, which we'll get into shortly, so you can get treatment promptly if needed. 9. Methyldopa. Methyldopa is a medication often used in controlling high blood pressure. This medication is notable for its safety, being even the most prescribed for pregnant women with hypertension. However, despite its overall safety, methyldopa has been associated with potential liver damage. So, if you've got any liver issues already, this might not be the best choice for you. Plus, here's the kicker. Those liver problems could pop up as late as 12 weeks after you've started taking methyldopa. That's why it's super important to keep tabs on how your liver's doing if you're on this med. We're all about keeping you healthy and happy. So, if you've got a history of liver woes, don't hesitate to chat with your doc about some safer options. 10. Antipsychotics. These are drugs when it comes to tackling psychoses and tough cases of depression. However, they're also notorious for messing with your liver, particularly by causing something called drug-induced cholestasis. Essentially, it disrupts the flow of bile from your liver, which is essential for digesting fats and eliminating waste, leading to serious hepatic damage. So, Keep an eye out for any signs your liver might be sending your way if you're on these meds. Have you ever met someone who has reactions to certain medications? Feel free to drop your thoughts on it in the comments section. It'll be really helpful and serve as a handy reference for us. For now, let's dive into recognizing the early signs of liver damage caused by medication. Liver damage doesn't always come with symptoms. You may not know your medication is affecting your liver until blood work reveals abnormal results. But if you do develop liver symptoms, they can include abdominal pain, abdominal swelling or distension, dark urine, nausea or vomiting, unexplained weight loss, yellowing of the skin and eyes. If you're taking a medication that carries a risk of liver-related side effects and you develop symptoms of liver inflammation that last more than a day, you should let your healthcare team know immediately. They will likely assess your liver function tests and decide if you need to stop taking the medication. If you aren't sure if a medication carries these risks, feel free to check in with your pharmacist. If you're wondering, can supplements cause liver damage? Then the answer is yes. In fact, studies show that supplements account for up to 20% of liver injury cases in the US. Dietary supplements linked to liver injury include bodybuilding supplements containing anabolic steroids, weight loss supplements containing green tea extract, certain vitamins when taken long-term and at high doses, such as niacin, up to 3,000 mg per day taken for several months, herbal products like ginseng and black cohosh. Keep in mind, not all supplements are linked to liver injury. Check with your healthcare team or pharmacist prior to taking a supplement to make sure it's appropriate for your situation. Final, the moment you've been waiting for, the answer to that intriguing question we kicked off with at the start of the video. How big do you think the liver is? The right choice is A. Soccer ball. Pretty unexpected, huh? Did you know that your liver is the largest solid organ inside your body? This football-sized powerhouse helps keep you alive and healthy. As you move throughout your day, it works hard to detoxify your blood, help with digestion, and restore your energy levels. We can't live without it. So, I'm going to leave a suggestion for you to watch on the end screen. It's a video in which I discuss the top 8 best fruits for fatty liver. I'm sure you will find it very interesting and surprising when you watch it. Lastly, I want to stress that this video aims to educate and should never replace personalized medical advice. It's crucial to talk to a healthcare professional before trying new supplements or making significant diet changes. Always prioritize your health and make informed choices. Thank you for tuning in, and we can't wait to have you join us again in our next video.